Hello, my name is Lisa Unger. I am presenting this brief video presentation which outlines the implementation of trauma-informed, recovery-oriented practice focusing on complex childhood trauma and emotional dysregulation, which are contributing factors in self-harming behaviours amongst adolescents. Erik Erikson's developmental model identifies adolescence as the stage of identity versus role confusion. This period is marked by significant physical and sexual maturation, the pursuit of economic and social independence, the formation of personal identity, the development of relationship skill building, and the ability to engage in abstract reasoning. Complex childhood trauma refers to the exposure of multiple traumatic events, such as severe abuse or profound neglect, occurring generally in early childhood. They frequently face challenges with self-regulation. This difficulty often drives them to engage in maladaptive behaviours, such as self-harm. They are more likely to engage in high-risk behaviours, including substance use, unprotected sexual activities, and criminal conduct. This type of trauma can result in heightened stress responses and long-term consequences, including physical, cognitive, behavioural, and significant mental health challenges. Adolescents affected by CCT frequently struggle with low self-esteem and poor academic achievement. These adolescents live in a perpetual state of fear and can predispose them to chronic health conditions such as heart disease and cancer, ultimately increasing a risk of premature death. Individuals affected by CCT encounter significant obstacles in accessing mental health services. These challenges are compounded by a deficient service system that does not consistently implement trauma-informed care practices. As a result, individuals often face traumatization when seeking services, which can leave them untreated and struggling with enduring consequences. A child's attachment to their caregiver is crucial for their development. This bond fosters trust and security, aiding in emotional regulation and enhancing their interactions with the world. Through secure attachment, children learn to perceive the world as a safe place and develop a sense of self-worth. However, when a child endures abuse or neglect, they frequently modify their behaviours to cope with the instability of their daily environment. Although these adaptations are understandable in threatening situations, children with complex trauma often rely on these behaviours in everyday contexts, leading to responses that deviate from the typical expectations. When caregivers are inconsistent and intimidating, children may develop negative beliefs about their competence and self-worth. Additionally, if caregivers exhibit poor emotional regulation through frequent outbursts of anger, low tolerance and aggressive behaviours, children are likely to mimic these behaviours. Self-regulation involves recognising and accepting one's emotional states, tolerating stressful emotions, managing emotional reactivity, and employing strategies to modify emotions and control behaviours in alignment with goals. A child experiencing CCT may struggle with impulse control and understanding the consequences of their actions. As a result, they may exhibit behaviours that appear erratic, oppositional, unstable, and extreme. Children who have suffered abuse from authoritarian figures may respond to perceived threats or blame with heightened aggression and defensiveness. Conversely, they might become excessively controlled, rigid, and overly compliant with adults. Self-harm encompasses behaviours involving self-injury, which may occur without suicide intent or with the intent to commit suicide. Self-harming behaviours include self-inflicted actions such as scratching, cutting, or burning. And these injuries often necessitate medical attention, and individuals who engage in self-harm are at an increased risk of suicide. Self-harm can serve multiple purposes, including self-punishment, soothing emotional distress, distracting from emotional pain, avoiding difficult emotions, and gaining a sense of control. Barriers to trauma-informed care. The lack of clinics with available practitioners who are trained in TIC make it difficult for adolescents to access the necessary support and treatment. Furthermore, whilst some providers, such as mental health sectors, youth systems and child protection departments, engage in TIC, their approach is inconsistent and limited. Additional barriers to implementing TIC include the widespread nature of trauma exposure, which often results in consumers being reluctant or unable to discuss their past traumas. Practitioners may hesitate to implement TIC practices if they perceive that the individual lacks the emotional resilience to process past traumas. Financial constraints pose a significant barrier as adolescents often lack their own financial resources. Furthermore, therapeutic practices are often too expensive for adolescents to engage in. There may be cultural barriers to seeking TIC due to the lack of cultural competence in practice. Additionally, a consumer's cultural beliefs and values are significantly influenced with their treatment and their recovery process. Shame is also a significant barrier for teenagers in seeking help due to the ongoing stigma our society places on mental health diagnosis. Prior to the implementation of TIC, it is necessary to undertake certain organisational changes. Building awareness among staff includes communicating TIC and its values, providing training on how trauma impacts behaviour and health across all staff members, to ensure patients are included in the planning and implementation and gain community feedback. Organisations should share the power within the therapeutic relationship and across organisation policies and procedures. Ensuring staff wellness is a priority by educating all staff on trauma stress, including vicarious trauma and self-care. Ensure leadership staff are set good examples and provide opportunities for staff wellness activities. And to ensure there is balance of work life and encourage staff to take paid leave. Organisations should hire trauma-informed staff. This includes hiring staff who value TIC and hiring staff with diverse backgrounds, as well as hiring staff who have life experiences in the same community. Other changes include providing a safe environment, which will allow the consumers to feel safe and reduce chances of re-traumatisation. This would include physical safety with keeping areas well lit and safe, low levels of distracting noises, and a calm, creative space with warm colour decor. Social and emotional safety include using positive language, understanding how culture affects a consumer's recovery. This may also include upgrades to the facilities practice. Procedures and policies within the organisation are vital for TIC to be implemented successfully. The organisation should include the 8 principles of TIC within the practice, which uphold an understanding of trauma and how it impacts the consumers. Establishing a clear mission and well-defined policies are essential as it enables staff to align their efforts with the organisation's values and overarching goals. Procedures should include providing trauma-informed staff training, a framework for screening all patients to ascertain the presence of trauma history, ensuring that the types of treatment options within the organisation are driven by the needs of the consumers, and providing collaboration with other services, and funding for research to monitor outcomes and benefits. Changes to professional practice when implementing TIC should include a focus on the well-being of staff, offering a supportive work environment to help protect staff from secondary trauma stress. This may include regular and consistent supervision, creating strong supports with work peers, offering casework that is varied and balanced to reduce overload, ensuring all staff have trauma training, ensure there is consumer feedback within the practice, and to offer consistent leadership and role models who lead by example. Staff awareness, staff competence and staff training in TIC is recommended for the successful recovery of the consumer and helps to build a strong foundation in the practice of providing TIC to the public. Staff with this training will be better able to successfully work with consumers without the risk of re-traumatisation. Ensuring staff wellness is essential to prevent burnout, vicarious trauma, and secondary traumatic stress. It is a responsibility of the practice manager to safeguard their staff, which includes implementing supervision and safe care policies and procedures. When staff are not supported in this way, their provision of care to the consumer will be inferior and may inhibit the healing process. Providing a safe environment is important to ensure re-traumatisation does not occur with the consumers. Safety encompasses the physical and psychological state of both the consumer and practitioner. Safety includes ensuring the practitioner is reliable, predictable, and respectful. Culturally competent staff indicate that the consumers will feel safe, supported, and respected throughout their recovery process. Policies and procedures enable frameworks which will allow consistent care and collaboration from all service providers. Consumers will often require the services of multiple healthcare providers in their recovery. If all services work on the TIC framework, it will enable a consumer to have consistent approach to their care. Adolescents suffering with CCT are impacted emotionally, physically, cognitively, behaviourally, and developmentally, and face long life effects of their trauma from a mental and physical health perspective when left untreated. Adolescents exhibiting maladaptive and high-risk behaviours are at an increased risk of suicide and premature death, underscoring the critical need for access to TIC. TIC is a framework for ensuring an empathic and evidence-based set of protocols are utilised when treating CCT. There are many factors for an organisation that must adhere to when implementing TIC in order for its successful implementation. For an adolescent experiencing CCT with dysregulated behaviours such as self-harming, TIC is a safe and positive evidence-based framework that can lead the practitioner and consumer on a pathway of recovery. Here are my references. Thank you for watching.